And on that subject of leadership, there's been a lot of discussion about why we're in the situation we're in again, only a year and a half into this government's term. And I've seen a lot of analysis that talks about the 24-hour media cycle. It says how hard it is for politicians to cut through because of the pressures of the 24-hour news cycle. I've heard about volatility in the electorate. I think the Prime Minister talked about the Victorian electorate as being absent-minded. Well, here's a bit of free advice. Stop looking for people to blame, right? Some advice for politicians. Start doing a better job and you might be rewarded by the community. Start doing a better job, because at the moment we've got a bunch of people in this place who are careerists, who have worked their way up from their very early years through political offices who stand for nothing. And we've got another bunch of people who are ideologues, who are out of touch with mainstream public opinion, who come up with thought bubbles in health that fabricate a crisis around health spending. Again, we heard today there's no crisis in healthcare. We've got a terrific health system. We could make it better, but we've got a terrific health system. We spend less than most comparable countries and we get much better healthcare. So you don't fabricate a crisis to further your own ends, and your ends are we want to introduce co-payments because we don't think that people are entitled to universal healthcare. That's where this comes from. So politicians need to just do some basic things. Start listening, start looking at evidence ahead of ideology, and you'll be rewarded for that, and take the community with you. So I think here's an opportunity for the Prime Minister to press reset on his Prime Ministership, to start again with health policy, to start talking to the crossbenchers and to other groups about where the real challenges in healthcare lie, and to ditch this idea that somehow making it harder for someone to access a GP is good health policy. It's not. This is a prescription for a two-tiered US-style health system. Everybody who's worked in this space, academics, doctors, the AMA and consumer groups agree if you're going to target healthcare for efficiencies, you don't do it by making it harder for people to go and see a GP.